Every patient shows you a number, but only a doctor sees the story behind that number. HbA1c is not a test, it's a timeline. It records every sugar rise, every fall, every mistake. And today, we decode that story the way only a clinician can. If you are a patient, please check part 1 in our profile. That version is simple and made for you. This video is for doctors and healthcare professionals. HbA1c is not just a number, it's a biochemical diary of red blood cells. Each red cell lives about 120 days and glucose keeps attaching to hemoglobin, forming glycated hemoglobin. Because red cells die and are replaced daily, HbA1c reflects the average glucose of the past 8 to 12 weeks. The last month contributes the most, nearly 50%. That's why therapy changes take time before HbA1c begins to fall. When the value goes beyond 6.5%, it confirms diabetes. For most adults, aim below 7%. For elderly or cardiac patients, keep it 7.5 to 8 to avoid hypoglycemia. For younger patients, around 6.5 prevents early micro-vascular damage. But remember, checking HbA1c alone is not enough. In a new diabetic, always see the full picture. Check hemoglobin to rule out anemia, add fasting and postprandial sugars and interpret together. Low hemoglobin or erratic fasting values can completely change the picture. False low results occur when red cell life is short, in hemolytic anemia, acute blood loss, chronic kidney disease, or after transfusion. Even erythropoietin therapy lowers it falsely by releasing young cells that haven't lived long enough to pick up sugar. False high results appear when red cells live longer, in iron deficiency, vitamin B12 or folate deficiency, alcoholism, or hypothyroidism. Certain hemoglobin variants like HbS or HbC can distort results depending on the lab method. So always verify the assay before reacting to an unexpected report. Sometimes HbA1c cannot be trusted in renal failure, pregnancy, or hemoglobinopathies. That's when we use fructosamine or glycated albumin. They show the last 2 to 3 weeks of control. A short-term mirror when HbA1c loses accuracy. Interpret it wisely, correlate clinically, and act early. Even a 1% reduction cuts micro-vascular risk by 40% and heart attack risk by 18%. If this video added value to your clinical thinking, like it, share it with your colleagues, and follow our channel for more authentic, evidence-based insights. Because medicine is not about numbers, it's about understanding the story behind them.